Hello and welcome. This is Deepak Mishra, and in this video I am going to tell you about Fachsprachprüfung. What is Fachsprachprüfung? It is a medical German exam. It is a requirement. It is an exam which the medical councils in Germany take before giving you a temporary medical license, before Berufserlaubnis. That is the exam. Fortunately, when I applied for my Berufserlaubnis in February 2015, I did not have to take this exam because that was not the rule then in Niedersachsen. But now, since April 2015, it is a rule in Niedersachsen, and I have talked to my colleagues and friends who have taken this exam and cleared it successfully. And with that information, I have compiled this video. So first of all, I'm going to take you to a paper I have downloaded from the website of Niedersachsen Ärztekammer, that is the medical council of Niedersachsen. That is information blot, information paper for medical for prospective candidates in Niedersachsen about Fachsprachprüfung. I'll turn the page now, and here is the here you can see the exam. They have mentioned about three parts for this exam, and I'm going to explain to you all these three parts. And because that this paper is in German, if you know German, it's very well and good. You can download it yourself and read it in detail. For those who do not know it very well, I would like to, and also I would like to share, I would like to explain it to you, and also the inputs from my colleagues and my friends, those who have actually taken this exam. So, first of all, when you apply, suppose we'll start talk from the beginning. You are a foreign medical graduate and you want to work in Germany. Okay, you have found a stellar. You have done your language and everything, and you have found a stellar, a job, appointment letter. Now you have to apply for Berufserlaubnis. Now you send all your documents to Ärztekammer, that is the medical council, and then they send all your documents for verification. So once your documents are verified, then they sent you a letter requesting you to make a payment of around 350 euros. That is the exam fee for this Fachsprachprüfung. And once you have made this payment, this money transfer, then you will get a termin, a date for your exam, this Fachsprachprüfung, and you have to be present in the Ärztekammer on that day, on this Prüfungsamt at this center, whichever address they give you on that date, and take this exam. Now I'm going to tell you about the parts of exam, how it is going to be. First of all, first part is simulierte Arzt-Patient-Gespräch. That means a simulated doctor-patient discussion. So first of all, the Prüfung Commission, there will be three people in that commission, the examiners. One of them, at least one of them, will be a doctor. Can be all three will be doctors, or two doctors, one non-doctor, or at least one from these exam commission will be a doctor. This exam is one-to-one, as in there are three doctors and one examinee, so one student. First part will be here in this simulated doctor-patient discussion, that is a history, is a meeting, what you call Gespräch. One person from these three examiners will pretend to be a patient, and you are his doctor or her doctor. Now you have to go ask for the symptoms, like normal history taking. That's the symptoms, past history, medical history, operations, and everything. Anamnese, that is called history taking. You have to talk to the patients about their after doing all the history. You have to give them a provisional diagnosis, that what can that be. They will ask you that, okay, what can that be, doctor, what do you think? You have to discuss with them. You have to tell them what do you think so far, and for further discussions or further information, what tests you would like to do. Then they will ask you about the tests. Then you should be able to explain the tests in German. Like suppose you say that, okay, I would like to do an X-ray. Then they will ask you, okay, what is X-ray? First of all, you should know that X-ray is called Röntgen here. Röntgen. So you should be able to tell them that, okay, what is Röntgen? And the benefits of that Röntgen, and then side effects of that Röntgen. Or if you want to do, say, suppose you think of a GI bleeding and you want to do a gastroscopy. So you should be able to explain to that patient in German, a simple German, that what is a gastroscopy, how do they do it, what is the preparation, what is the risks from these things, and you should be able to answer the questions of that patient, and you should be able to relieve that anxiety of that patient regarding this test. That is the part of this discussion. About You should be able to inform the patient about the diseases, the prognosis of the diseases, the normal patient. Whenever you go to a clinic and patient comes to you, and the questions the normal patient has, you should be able to discuss these things with the patient in a simple German. Patient should be able to understand you, and you should be able to understand the patient. This entire thing is going to take 20 minutes. This first part is of 20 minutes. You have to finish it off in 20 minutes. Then you will get a 20 minutes time to write all these documents. You should be able to document everything. You'll get a rough paper. Suppose I'll show you. You'll get a page like this. You'll get a blank page. You have to make columns like this, that information of the patient, main chief complaints, allergy, and Unverträglichkeit, that is called, like intolerances, family history, past history, social history, and all those things. Provisional diagnosis, your plan, your those things you have to write. That is the documentation part. For that, you will get around 20 minutes time. In this 20 minutes time, in this documentation part, you have to prove that your German language, that is written German language, is up to the level where you can write official medical documents and write medical certificates, official medical things. That is the aim of this exam, this second part, that is a documentation. And third is your Arztgespräch, that is a doctor-doctor discussion. That's the third part of your exam. Here, as I told you, you will have three examinees in the beginning. Now you will take the case which you have taken in the first part, that you will go and you will present it to your examiner. It is like a final year MBBS exam, like we have it in India, the practical exam. You take a history, then you present the case. You go to the examiner, you introduce yourself, you start presenting your case, and then they will ask you questions about that case. That, okay, why did you ask this? The same simple like what we have in India, or any other MBBS course at the end. Why did you ask this? What are the symptoms of this? This? Why do you suspect this? What tests would you like to do? Why this? Why that? The basic information. So when you read this paper, it's this letter about Fachsprachprüfung. They have mentioned somewhere that ärztliche Fachwissen wird nicht in der Fachsprachprüfung überprüft. Here you can read das ärztliche Fachwissen. That means that your medical knowledge shall not be tested during the exam. That is written on that official paper. But do not believe that, because from the people who have taken this exam, they have told that, and everybody has told, I have talked to like 8-10 people who have taken this exam, and they have been asked questions, medical questions, because the logic is also very simple, that okay, that is called that it is just a medical German exam, you just need to know terminology, but you are already a doctor. A certain level of medical information and medical knowledge from you is expected. That goes without saying, that you are supposed to know what is diabetes and what medicines do you use for diabetes, and you're supposed to know what is hypothyroidism and what is the what tests you do for hypothyroidism. So you're supposed to know that. So that goes without saying. So don't believe that no medical testing will be done. There will be medical information will be tested. Yeah, definitely not to a very high extent like an approbation, not that much, but certainly. So this is the part. These are three parts, and the fourth part here is you have to do the translations. After this, you will go in another room, and there you will get 6 words. 6 words will be in German. That is a medical German. Medical German is mostly Latin. So all the terminology is of Latin most of the times. So those Latin words you have to convert it into simple layman German. And then you will get 6 words of Latin, layman German, simple German, and that you have to convert it into Latin. That is like typical official German language that you call medical language, official medical language is Latin. So these are the 4 parts of this exam. You have to always remember that when you are in a doctor patient discussion, if other person is behaving as a patient, you're talking to a patient, you have to always use very simple German, basic layman German. Not suppose you have say stomach pain, so you do not say stomach pain, that is Bauchschmerzen. You say abdominal Schmerzen. So like sorry, when you talk to a patient, you have to be in a you have to use layman terms with the patient. And when you are with a doctor who is, you're talking to a colleague, you're presenting the case, there you have to be very cautious that you do not use these layman German terms. You have to use that official Latin terms with the doctor. And always be careful. Pronunciation is of very important, is very important, because you do not want to pronounce things in English. They hate that because you are not in England, you are in Germany. So you have to speak like a German. Is you have to speak in German tone, in German what you say pronunciation, the way they pronounce it. So abdominal, it's not abdominal. Spelling might be the same. It's not abdominal, it's abdominal, like that. So the sources of preparation I shall post it in the descriptions of this. The links I shall post in the description of this video. And I think this video should help you guys. Yeah, what more do I have? I have nothing more as such right now. One more piece of information is in Niedersachsen Ärztekammer, I have read that they do not want a B2 certificate anymore. So before was the case that you need to have at least a B2 certificate. You should show that you have a B2 certificate from Goethe or any other institute. But the rule has changed itself, and now your Deutsch Kenntnisse, that is your language knowledge, shall be tested on this exam, on this Fachsprachprüfung exam, not on any certificate. So if you have taken suppose B2 exam 2 times and 3 times and you are not able to clear it, you're failing it by 1 mark, 2 mark, that does not, I mean, that means that your knowledge is of that level, but you are not able to clear that Stufa, you're not able to get that certificate. So in that case, you don't need to worry anymore because that certificate is not needed. You can move ahead and prepare for this exam, because this exam is going to test your medical knowledge, and not only medical knowledge but your German language. So you do not need a B2. Yeah, having said that, that does not undermine the importance of this test of this language, because if you read here, it says that Fachsprachprüfung is of level C1. You see here it's of level C1. So even though you do not need a certificate from B2, you need a level of language that is of C1. So having said that, I take your leave here. I hope you like this video and this video will help you. Do like, share and comment on this video, what you like, what you don't like. And I'll try to make more videos and more informative videos and share it with you guys. Thank you very much. Have a nice day. Bye-bye.